let's see, it's 11.2. Huh? Salah lah. The doctor said my diabetes is very well controlled. It was only 6.8 when I did my blood test last month. Auntie, the test you did last month is your HbA1c. What I'm checking now is your capillary blood glucose, CBG. Let me tell you the difference. Hi, my name is Irene. I'm a physiotherapist specializing in chronic disease management and exercise therapy. On this channel, we'll talk about everything related to exercise and health, empowering you with the knowledge and skills to achieve your health goals. Check out these glucose molecules moving along the bloodstream. If we were to prick your finger and take a drop of blood for testing right now, we're essentially taking a snapshot of what the blood glucose level is at this very moment. And that is what the CBG is all about. How high or low this value is depends on various factors such as prior food intake, physical activity, as well as the presence of any diabetes medications in the system. So the CBG is a highly variable thing and it will change very rapidly throughout the day. For example, if we were to take it 15 minutes later, it will probably give you a different value. So if we were to monitor the CBG for the entire day and plot the graph, it will probably look something like this. On the other hand, HbA1c measures the average blood sugar level in our system over a period of 3 months or so. HbA1c stands for glycated hemoglobin. So glucose molecules love to attach themselves to hemoglobin, which is a protein found on our red blood cells that transports oxygen. So someone with a higher blood glucose level over a period of a few months will have more glucose molecules attached to their red blood cells when they actually do a HbA1c test. And every 3 to 4 months, our body actually destroys old red blood cells along with the attached glucose molecules and then regenerates new red blood cells. And that is why our HbA1c test result is only reflective of the average blood sugar level over the past few months and not for a longer time period. So how do these two tests work together? Think of the CBG as your daily weather forecast. You use the weather forecast to decide what clothes to wear and whether to bring an umbrella out. So similarly, we use the CBG to make day-to-day decisions. For example, is my CBG level safe to exercise now? Oh, my CBG level is a little low after exercise and there's still 2 hours to my next meal. I should take a snack first. Wow, my CBG level rose so rapidly after that meal. Maybe that's something that I should not take so often. So using the same analogy, your HbA1c's equivalent would be climate trends. It gives you sort of your quarterly report card so that you know whether you're generally on the right track. It also allows your doctors to assess whether they need to adjust your medications for better control. So to recap, this table shows a quick comparison of the two tests. CBG gives you a real-time immediate measure used for daily monitoring and decision-making, while HbA1c shows a 3-month average that assesses your long-term glucose control. CBG is done through a finger prick test, while HbA1c normally requires a laboratory blood test. Your CBG may fluctuate daily depending on food, activity, and medications, while the HbA1c is more stable, showing an overall trend. I hope you found this video helpful. Understanding the differences between your HbA1c and your CBG test will allow you to better use this information to control your diabetes. Once again, remember that this information is meant for educational purposes and not meant to replace medical advice. If you require tailored advice, please approach a qualified healthcare professional. If you like this video and would like to learn more about exercise and health, hit like, subscribe, and turn on the notification bell. Thanks for watching and have a nice day.